The last piece that I want to just touch on, because our time is limited today, and this is a whole new topic, but I want to touch on that, answering the question language difference or disorder and the special education eligibility process. When EL students reach Tier 3 and special education is a possibility when it's considered, I strongly suggest that we consider a comprehensive evaluation be conducted. Absolutely. So that means bringing the parents in. They would need to have their parental safeguards delivered to them, and they would need to agree to assessment. And a cognitive assessment then, well, the team would consider the kinds of assessments needed. And I would recommend a cognitive assessment be completed in the student's native language and English. The academic assessment could be completed in their language or languages of instruction. So say, for example, the student was in an English-only program, that achievement assessment need only be done in English because they've never had native language assessment. The speech and language assessment should be done in both languages, native and second language. So what we're looking for is to establish a bilingual profile of performance based on the students' combined knowledge, again, that totality of their language base, which is 2 languages and sometimes 3 languages.
Correct.
So assessing in both languages allows for a description of what they know cumulatively, and that's what we want to be getting to. So through this process of assessment, no single procedure or test is used. So it's a totality and, again, a convergence of evidence. So we use the evidence that we've gathered throughout the tiers and the evidence through standardized assessment, and together try to create a picture of the student as a learner and as for their learning needs. And that non-discriminatory assessment is a process, so it's a framework to consider the relevant information that we've discussed before, and that is looking at the student's background, language, culture, educational background, as we're considering what their needs are. So I will refer teams to the work of Flanagan and Ortiz and their cultural language interpretive matrices, and you can Google them and learn more about that procedure, which is a way of interpreting standardized cognitive assessment scores that really help us tease out the biases of cultural differences and language demands of cognitive instruments. And I will just want to leave us with this. Remember, all children have the capacity to learn a second language to the level to which they can learn a first. Our language learning capacity is not language specific. We are born with a capacity to learn any language, not just a specific language. And when a language is being developed, be it a first or second language, the focus should initially be more on basic skills, provide lots of contextual cues such as pictures and gestures, and that whenever possible, new concepts and skills should be introduced in the child's strongest language so that they can capitalize on existing skills and increase learning efficiency. And if we want to really increase the academic achievement of English learners, we need to consider more native language programs. And when that's not possible, we all need to be well-versed in teaching rigorous language skills and content to English learners. So thank you for having me here today. It's been a delight.
Thank you, Julie. As we end this session together, I think the first thing that comes to mind is how much we are alike in many ways in terms of our mission in working with English learners, and especially in that language difference versus language disorder arena. So thank you for coming, and I look forward to future research collaboration.
Me too. Thank you.
Bye-bye.